Business engagement is important for a couple of reasons. One is obviously the workforce of people who work for companies around the world. So in terms of a healthy, productive workforce, that's very important. That's the first thing. Second thing is obviously new products and services. That's very important. And particularly in terms of global health, looking at emerging economies, which are really the next growth area, both for the businesses themselves as well as emerging needs as a burden of disease shifts from classic infectious diseases to non-communicable diseases. Well, Eli Lilly Ford is maintaining the commitment that Eli Lilly's had since 2003, and even earlier to MDR-TB, through the MDR-TB partnership. The completion of the transfer of manufacturing technology, and going forward is the engagement to train the healthcare providers and to support the scale-up of drug supply and access of MDR-TB drugs. And in non-communicable diseases, we have a new program, which NCD initiative, which is looking at engaging ways to create shared value around tackling the diabetes epidemic, which is increasing, as I said earlier, and especially in these emerging economies. The best application was really one using shared value, very innovative, drawing from other areas of carbon and carbon offsets. I don't know if I can give it away, but a very, very creative way. And what I was also impressed was the large scale of it. So it's not really just pure classic corporate responsibility, which is not connected with the business, but one that's very much integrated with the business of the particular application that I liked. It's hard to say. I think that the real trend is to look at that doing what's good for society, what's good for public health in general is completely compatible or can be compatible with business objectives. And it's to look and identify those opportunities, because that's what creates a much more sustainable thing for corporate responsibility and engagement of businesses when they look for the new opportunities. It won't be necessarily easy to find, but I think there's great opportunity, and you know, the emerging economies, again, I come back to the countries such as China, India, Brazil, Russia, and many others which are really moving up, have changing burdens of disease, as I said earlier, and really I think great opportunities not only in terms of the needs and the evolving of the needs, but also in terms of their capacity to innovate as they move from pure agriculture to pure manufacturing to now untapped innovation, which can be harnessed and improve health not only in those economies, but I think globally we'll all benefit.